That nagging backache you've been blaming on an old mattress or a long day of gardening might be your body sending a far more urgent message. For seniors, dismissing subtle pains can be a risky gamble. Kidney stones are a growing health concern for older adults who may be more vulnerable to complications. Recognizing the early warning signs is crucial, as prompt intervention can prevent severe pain, infections, and even kidney damage. This article highlights the 7 warning signs of kidney stones that seniors and their caregivers should never ignore. Number 1, persistent flank or back pain. One of the most common and often earliest indicators of a kidney stone is a persistent pain located in the flank or back, specifically just below the rib cage. This discomfort is frequently misunderstood or dismissed as a routine backache, muscle soreness from overexertion, or a simple sign of getting older. However, unlike a typical muscle strain that might improve with rest, kidney stone pain tends to linger and can have a distinct, deep quality to it that feels different from surface-level muscle aches. It's a signal that something is happening internally that requires attention. The pain associated with a kidney stone isn't always static. It often arrives in waves, a pattern known as renal colic. You might experience periods of a dull, manageable ache that suddenly intensify into sharp, severe pain for several minutes or even hours before subsiding again. This fluctuation happens as the stone moves within the kidney or begins its journey down the ureter, the narrow tube connecting the kidney to the bladder. The body's muscles contract around the stone in an attempt to push it along, causing these painful spasms. As the stone continues its slow and arduous journey, the location and intensity of the pain can evolve. The discomfort may start to radiate from the side or back and move downwards, wrapping around toward the lower abdomen or groin. This progression is a classic sign that the stone is on the move. For seniors, it's incredibly important to pay close attention to any unexplained or lingering pain in these specific areas, especially if it doesn't respond to typical remedies like heating pads, gentle stretching, or over-the-counter pain relievers. Ignoring this persistent signal could delay a crucial diagnosis. This radiating pain is not random. It follows a specific path, and understanding its trajectory gives us our next important clue. Number 2, radiating pain to the groin or lower abdomen. As a kidney stone leaves the relatively open space of the kidney and enters the narrow confines of the ureter, the nature of the pain changes significantly. This is where the characteristic radiating pain begins. The discomfort no longer stays confined to your back or flank. Instead, it starts to travel downward and forward, following the exact path of the ureter as it descends toward the bladder. This is a telltale sign that helps distinguish kidney stone pain from other abdominal or back issues. The sensation often extends into the groin area, the lower abdomen, and for some, even into the inner thigh on the affected side. Men may experience pain in the testicles, while women might feel it in the labia. This occurs because the nerves that supply the kidney and ureter are shared with these other regions. As the stone irritates the ureter, the brain interprets the pain signals as coming from these connected areas as well. Understanding this specific pattern of radiating pain is invaluable for both seniors and their caregivers. It provides a clearer picture that separates this condition from something like a simple muscle strain, a hernia, or digestive upset. While other conditions can cause abdominal or groin pain, the combination of flank pain that migrates downward in this predictable way is a strong indicator of a kidney stone. Paying attention to this distinct travel pattern can help you provide a more accurate description of your symptoms to a healthcare provider, leading to a faster and more accurate diagnosis. While pain is a primary signal, the stone's journey also creates noticeable disruptions in urinary function, which we'll explore next. Number 3, changes in urinary habits. When a kidney stone travels into the lower part of the ureter, close to where it connects with the bladder, it can cause significant irritation and create a partial blockage. This interference directly impacts your normal urinary patterns, leading to noticeable and often abrupt changes. One of the most common signs is a sudden and compelling urge to urinate more frequently than usual. This feeling of urgency can be persistent, making you feel as though you constantly need to go to the bathroom, even if you've just been. This increased frequency isn't just limited to the daytime. It often continues through the night, a condition known as nocturia. Seniors may find themselves waking up multiple times to urinate, disrupting sleep and causing fatigue. Furthermore, the urge can be deceptive. You might feel a powerful need to empty your bladder, but then find that only a small amount of urine comes out. This happens because the stone's presence near the bladder fools the nerves into signaling that the bladder is full when it's not. For seniors, these symptoms can be particularly confusing, as altered urinary habits are sometimes associated with other age-related health issues, such as an enlarged prostate in men or changes in bladder support in women. However, the sudden onset of these symptoms, especially when accompanied by pain, should raise a red flag. Monitoring for a distinct shift in how often you need to urinate, how strong the urge feels, and whether you have difficulty starting the stream is essential for identifying a potential kidney stone blockage. Beyond the frequency and urgency, the actual experience of urination can also become uncomfortable, bringing us to another critical warning sign. Number 4, painful or burning urination. As a kidney stone makes its way through the urinary tract, it can cause significant irritation to the sensitive lining of the ureter and bladder. When the stone reaches the bladder, or is in the process of being passed out of the body through the urethra, it can lead to a sharp, painful, or burning sensation during urination. This symptom, known as dysuria, occurs because the stone physically scrapes against or inflames the delicate tissues, turning a normal bodily function into a dreaded and uncomfortable event. This burning or stinging feeling can easily be mistaken for a urinary tract infection, UTI, which is also common in older adults. Because the symptoms are so similar, many people may initially assume they have a simple infection. However, when painful urination is experienced alongside other key warning signs, such as flank pain, radiating discomfort to the groin, or changes in urinary frequency, the likelihood of a kidney stone increases significantly. The combination of these symptoms paints a more complete picture for proper diagnosis. For elderly patients, any instance of persistent pain or burning during urination should be a signal to seek medical attention without delay. It is not a symptom to be ignored or self-treated with cranberry juice in the hope that it will resolve on its own. A healthcare professional can perform the necessary tests to determine whether the cause is a kidney stone, a UTI, or another underlying issue. Getting a prompt and accurate diagnosis is the first step toward receiving the right treatment and preventing further complications. In addition to causing pain, the physical irritation from a stone can produce a very visible and alarming sign in the urine itself. Number 5, blood in the urine, hematuria. The presence of blood in the urine, a condition known as hematuria, is a hallmark sign of kidney stones and one that should never be dismissed. As the jagged, crystalline stone moves and tumbles through the narrow passages of the urinary tract, its rough edges can cause tiny cuts and abrasions along the lining of the kidney and ureter. This minor bleeding results in blood mixing with the urine, causing a noticeable change in its color. The discoloration can vary widely. Sometimes, the urine may appear distinctly pink, red, or the color of cola or tea, which indicates a more significant amount of bleeding. In other cases, the amount of blood may be so small that it's not visible to the naked eye and can only be detected through a laboratory test. Any visible change, no matter how slight, is a clear signal that something is causing trauma within your urinary system. Seniors and their caregivers should treat any instance of visible blood in the urine as a matter of urgency. While a kidney stone is a very common cause, hematuria can also be a symptom of other serious conditions, including bladder or kidney infections, injuries, or even cancer. Therefore, it's essential to seek an immediate medical evaluation to determine the underlying cause. Don't wait to see if it goes away on its own. A swift diagnosis is crucial for ruling out more dangerous possibilities and ensuring you get the appropriate care for kidney stones before they lead to more severe issues. These physical signs are often accompanied by systemic symptoms as the body reacts to the intense pain. Number 6, nausea and vomiting. The connection between kidney stones and feelings of nausea may not seem obvious at first, but it's a very common physiological response. There are shared nerve connections between the kidneys and the gastrointestinal tract. When a kidney stone causes intense pain, it can trigger these nerves, leading to an upset stomach, nausea, and in many cases, vomiting. The severity of the pain is often directly proportional to the intensity of the nausea. For seniors, persistent nausea and vomiting present an elevated risk. It can quickly lead to dehydration, which not only worsens the pain of a kidney stone, but can also strain kidney function further and lead to an electrolyte imbalance. Dehydration can cause weakness, dizziness, and confusion, increasing the risk of falls and other complications in older adults. Managing fluid intake becomes a critical challenge when you feel too sick to eat or drink. While nausea and vomiting are nonspecific symptoms that can be attributed to many different health issues, their presence alongside urinary changes or the characteristic flank and groin pain strongly points toward a kidney stone. If you or a senior you care for are experiencing this combination of symptoms, it's a clear indicator that a medical review is necessary. It's important not to dismiss it as just a stomach bug, especially if the other warning signs are also present. In the most serious cases, these symptoms can be joined by one more sign that signals a true medical emergency. Number 7, fever or chills. The onset of a fever or chills in combination with other kidney stone symptoms is a major red flag and constitutes a medical emergency. These signs almost always indicate that a kidney stone has caused a complete or partial blockage in the ureter, trapping urine behind it. This stagnant urine becomes a breeding ground for bacteria, leading to a serious infection in the kidney, a condition known as pyelonephritis, or a widespread infection in the bloodstream known as urosepsis. When an infection takes hold, the body's immune system responds by raising the body temperature to fight off the bacteria, resulting in a fever. The chills or shivers you might experience are the body's way of generating more heat. For seniors, whose immune systems may not be as robust, any infection can become dangerous quickly. A kidney infection that is not treated promptly can lead to permanent kidney damage or become life-threatening if it spreads throughout the body. If a senior is experiencing pain consistent with a kidney stone and develops a fever or begins to have chills, it is critical to seek immediate medical care at an emergency room. This is not a situation where it's safe to wait for a doctor's appointment. Prompt treatment with antibiotics and procedures to relieve the blockage are essential to control the infection, prevent sepsis, and protect the kidneys from lasting harm. Understanding kidney stones in seniors. Kidney stones pose a particular threat to seniors for several reasons. As we age, our kidney function naturally tends to decline, making it harder for the body to process waste products and minerals that can form stones. Furthermore, seniors are more likely to be taking multiple medications, such as diuretics or calcium-based antacids, which can increase the risk of stone formation. Chronic dehydration is another significant factor. Older adults may have a diminished sense of thirst or mobility issues that limit fluid intake, creating concentrated urine where stones can easily crystallize. Because of these heightened risks, timely detection is even more urgent in this age group. A kidney stone that might pass with minimal issues in a younger person can lead to severe complications for a senior, including overwhelming infections, acute kidney injury, or a prolonged and painful hospital stay. Recognizing the warning signs early is not just about managing pain. It's about preventing a cascade of serious health events. When to seek medical help. It is essential not to ignore the warning signs detailed in this article. For symptoms like persistent pain, changes in urination, or blood in the urine, you should schedule an appointment with your doctor for an evaluation. However, certain situations demand more immediate attention. You should go to the emergency room if you experience unbearable pain that cannot be managed at home, are unable to keep fluids down due to persistent nausea and vomiting, or, most importantly, if you develop a fever and chills alongside your other symptoms, as this indicates a serious infection. Prevention tips for seniors. The most effective step in preventing kidney stones is staying well hydrated. Aim to drink enough water throughout the day to keep your urine light yellow or clear. Dietary adjustments can also help. Depending on the type of stone you're prone to, your doctor may recommend reducing your intake of sodium, animal protein, or oxalate-rich foods like spinach and nuts. Attending regular medical checkups allows your doctor to monitor your kidney health and address risk factors early. Above all, always report any new or unusual symptoms to your healthcare provider promptly. Kidney stones can be more than just a painful inconvenience for seniors. They can be a serious health threat. By learning to recognize the 7 key warning signs, from persistent back pain to the emergency signal of a fever, you can take control of the situation. Acting on these signs can prevent complications and improve outcomes, offering the best chance for relief and a swift recovery. Share this article with friends, family, or caregivers to help them recognize kidney stone warning signs early. For more essential senior health updates, subscribe to our channel. If you have personal experiences or questions about kidney stones in seniors, please leave a comment below. Your stories can help others stay informed and healthy.